High blood pressure or hypertension is a serious health concern, and in some situations like that of a hypertensive crisis where your blood pressure spikes dangerously high, it can be life-threatening. In this video, we will teach you some steps you can take to lower blood pressure. We'll also go over some tips on how you can avoid this from happening, as well as some helpful lifestyle modifications that can help you manage your blood pressure. Let's start with a quick discussion on what a hypertensive crisis is and why it happens. A hypertensive crisis occurs when blood pressure rises suddenly and severely to readings of 180 over 120 millimeters of mercury or higher. This dangerous condition can lead to organ damage and requires immediate medical attention. Several factors can trigger a hypertensive crisis. These include not taking or missing your blood pressure medication doses, suddenly stopping certain heart medicines, drug interactions with other meds you may be taking, illegal drug use, underlying conditions like kidney disease, and adrenal gland tumors. This is a dangerous condition as it can lead to potentially life-threatening complications such as stroke, heart attack, heart failure, aortic dissection, pulmonary edema, kidney damage, and even vision problems. A person in hypertensive crisis may experience the following: severe headache, chest pain, shortness of breath, confusion, vision changes, anxiety, nausea and vomiting, and they may even go into a seizure. Now, let's get into what you should do if you or someone you know is having a hypertensive crisis. Firstly, call emergency services. This is a medical emergency and will need to be treated in a hospital. If ignored, it can lead to the complications we mentioned. So, call 911 or your local emergency number right away. While waiting for help, here is what you can do. Lie flat and remain as calm as possible. Take slow, deep breaths to reduce stress. And if prescribed blood pressure medication, take it as directed. Do not attempt to drastically lower blood pressure at home, as this often requires careful medical supervision. While waiting for emergency care, you should also avoid caffeine-containing beverages and do not engage in any physical activity. It would also be helpful if you keep a record of your blood pressure readings and medications to provide to emergency responders. This information can be valuable for the medical team treating you. Now, let's get a little deeper into some of the steps that you should be taking. First, we recommend practicing the 60-second breathing technique. To do this, lie flat and inhale deeply through your nose for 5 seconds, hold it for 1 to 2 seconds, then exhale slowly through your mouth for another 5 seconds. It is also a good idea to stay hydrated by drinking water, as this can help dilute your blood and temporarily reduce blood pressure. There are also certain calming techniques that you can use. Apply cold compress to your forehead, neck, or wrists to help construct blood vessels. Consider drinking caffeine-free beverages like hibiscus or chamomile tea to promote relaxation, and avoid any strenuous activity or stimulants that could worsen the situation. You can also eat foods rich in potassium and magnesium. These can include spinach, bananas, and even pumpkin seeds. Now, what if you are not in a hypertensive crisis but would just like to lower your blood pressure in a natural way? We've got you covered too. First off, you can practice some of the calming techniques we already mentioned. To add to those, you can also try a technique called progressive muscle relaxation. This is where you systematically tense and relax each muscle group in your body, starting from your toes and moving up to your head. This technique helps reduce physical tension and promotes overall relaxation. Next, you can also try gentle self-massage. Focus on massaging pressure points known to affect blood pressure. These include your temple areas using gentle circular motions, the back of your neck with light kneading movements, your shoulders and upper back using slow, deliberate strokes, and your palms and wrists with thumb pressure. You can also try out sound therapy. One of our favorites is the humming technique. It's so easy. All you have to do is hum a tune to yourself for maybe 5 or 10 minutes. Make sure that you are sitting comfortably when doing so. The vibrations from humming can help activate the vagus nerve, which plays a crucial role in lowering blood pressure. If a tune is not coming to mind, you can instead create a sustained sound for 5 to 10 minutes too. If humming isn't helping, you can try music therapy. Listen to calming music with a slow tempo around 60 to 80 beats per minute. Genres you can choose include classical or instrumental pieces and nature sounds or ambient music. Maintain a listening session for at least 15 minutes. You can also take a page from anxiety management techniques and try some mindful practices. These include guided imagery. Visualize a peaceful, calming scene while practicing deep breathing. This combination can help reduce stress hormones and lower blood pressure naturally. Another anxiety management technique that can do wonders for your blood pressure is body scan meditation. To do this, lie down and focus your attention on different parts of your body, sequentially releasing tension as you go. This practice combines well with progressive muscle relaxation for enhanced benefits. Now, let's talk about how you can avoid a hypertensive crisis. Preventing a hypertensive crisis requires consistent management of your blood pressure through several key strategies. Take all prescribed medications exactly as directed and never skip doses. Monitor your blood pressure regularly at home and maintain detailed records of your readings. Follow a heart-healthy diet low in sodium, incorporating plenty of fruits, vegetables, whole grains, and lean proteins. You can also benefit from practicing regular physical activity, stress management, and making sure that you get quality sleep. You should also check your blood pressure readings regularly. If you notice your blood pressure rising, seek medical attention immediately rather than waiting for it to become critical. Regular checkups with your healthcare provider help ensure your treatment plans remain effective. A hypertensive crisis and having uncontrolled hypertension in general is dangerous. It can wreak havoc on your bodily systems, including affecting your heart health, lead to stroke, and so much more. It is therefore important that you keep your blood pressure in check. If you want to improve your heart health, check out our video on new ways to prevent heart disease. A link to that should be on your screens now. We've also added it to the description box below. If you want to see more, please consider subscribing to our channel. Your Wellness Journal is run by a team of nurses, and we offer videos on health and wellness from the perspective of medical professionals who have been trained to always put you first. We are your Wellness Journal. Have a healthy day.